Eyecryl Phakic range of IOLs. Unleash the independence. Eyecryl Phakic IOL is implanted in the eye using disposable lens delivery system, which enables delivery through 2.8 mm incision size. Implantation of Eyecryl Phakic range of IOLs requires a few steps to follow. Lubricate the cartridge with any Biotech certified dispersive OVD. Open the vial and take out the holder containing Eyecryl Phakic IOL, as shown here. Pick the lens with the help of forceps. At this time, avoid touching the lens's central optic area with sharp ends or edges of forceps. Place the lens in the cartridge loading chamber, checking correct orientation of marks which are on the leading left and trailing right corners of the haptics. Make sure that the IOL must be placed in the loading chamber at proper place as shown here. Ensuring haptics of IOL are not near to the entrance of the cartridge. Press the lens in the cartridge as shown here, and carefully close the cartridge flaps and attach the cartridge to the injector body. Dip the cartridge tip end in sterile saline fluid for the lens to remain hydrated until the time of implantation. Make 1 or 2 paracentesis as per your standard practice. Inject adequate amount of any Biotech certified dispersive OVD in the eye. Do not overfill the eye with OVD. Make main incision of 2.8 mm on temporal site. Observe free movement of the lens under the microscope by pushing and retracting the plunger once. Now, insert the cartridge tip in incision and inject Eyecryl Phakic lens slowly. Once the lens reaches up to the cartridge tip, retract the injector plunger once again to avoid any chance of silicone tip overlapping the haptics. Now, push the injector plunger forward again until the lens is delivered. Ensure correct orientation marks when lens comes out from cartridge. At this time, if required, the entry of the lens in the eye can be controlled using instrument through side port. Now, tuck all 4 haptics one by one behind the iris as shown here, and place the lens in posterior chamber. Remove OVD completely from the eye and close the wound. Apart from the steps of loading and implantation of Eyecryl Phakic IOL, follow a few more steps to implant Eyecryl Phakic toric IOL. Mark references on 0 and 180 degrees on cornea. Check in calculation sheet for axis on which the Eyecryl Phakic toric lens has to be finally placed. Mark axis for lens placement on the cornea during the surgery. Implant Eyecryl Phakic toric IOL horizontally from temporal incision and tuck haptics one by one like Eyecryl Phakic IOL. remove OVD completely from the eye. Rotate Eyecryl Phakic toric lens as instructed in calculation sheet to finally set the lens on intended marked axis for placement and close the wound. Eyecryl Phakic range of IOLs. Unleash the independence.